You're at the doctor's office. Nothing major, just a persistent cough that won't go away. Maybe some chest tightness. You sit in the waiting room filling out forms. Insurance information, payment method on file. You have insurance. Good insurance, even. You're paying $450 a month for it through your employer plan. The appointment itself takes 12 minutes. The doctor listens, writes a prescription, orders a chest x-ray just to be safe. You check out at the front desk. They hand you a receipt. Your portion today is $180. Your portion. You're already paying $450 a month, and now you're paying $180 for a 12-minute appointment and a prescription you haven't even picked up yet? And there's this thing in the back of your head, this quiet realization that having insurance somehow doesn't mean you stop paying for healthcare. It just means you pay twice. My name's Peter, and if you've ever looked at your insurance premium and your medical bills and wondered what exactly you're paying for and why having coverage still feels like not having coverage, make sure you hit that subscribe button, because the math here is deliberately designed to be confusing. So let's talk about what health insurance actually costs when you add up all the layers. You're making $62,000 a year. Your employer offers health insurance. The good plan costs you $450 a month in premiums. That's $5,400 a year coming directly out of your paycheck before you've seen a single doctor. But that's just layer one. Layer two is your deductible, the amount you have to spend out of pocket before insurance starts paying anything beyond preventive care. On your plan, that's $3,000. So in a year where you actually use healthcare, let's say you have a few doctor visits, some minor procedures, some prescriptions, maybe one urgent care visit, you're paying $5,400 in premiums, plus up to $3,000 in deductible spending. That's $8,400 before insurance has paid a single dollar toward most of your care. And here's layer three. Even after you hit your deductible, you don't stop paying. You've got coinsurance, the percentage of costs you still cover. On most plans, that's 20%. So if you need something that costs $5,000 after you've hit your deductible, you're paying $1,000 of it. Then there's layer four, the out-of-pocket maximum, the theoretical ceiling on what you can pay in a year. On your plan, that's $6,000. So if you have a really bad year health-wise, you'll pay $5,400 in premiums, plus $6,000 in out-of-pocket costs. That's $11,400 total. Let's put that in context. You're making $62,000. After taxes, you're taking home about $3,850 a month. If you actually need medical care and hit anywhere near that out-of-pocket max, healthcare is costing you almost 3 full months of take-home pay for insurance that's supposed to protect you. And here's the thing that makes this particularly brutal. For most people, the insurance never kicks in a way that feels meaningful. You're paying premiums all year. You're paying deductibles for every visit. You're paying coinsurance after that. The insurance is technically covering things, but it never feels like it's covering things. You're still opening your wallet every single time. Most people think health insurance works like car insurance. You pay a premium, and if something happens, insurance handles it. Maybe you have a small deductible, $500, $1,000, and then you're done. That's not how health insurance works. Not even close. Health insurance is structured so that you pay continuously at multiple layers for almost everything. The premium is not the price of coverage. It's the price of access to a slightly discounted rate on care that you will still largely pay for yourself unless something catastrophic happens. And here's the mechanism that makes this feel extra disorienting: the preventive care illusion. Your plan covers annual checkups, some screenings, preventive visits, no cost to you. And that makes it feel like the insurance is working, like you're getting value. But here's what that actually means. The insurance covers the things you need least, the routine, predictable stuff that doesn't cost much anyway, and leaves you paying heavily for everything that's actually unexpected or expensive. An annual checkup? Covered. The follow-up when they find something concerning? That'll be $180, plus the cost of any tests, plus prescriptions. The system gives you free preventive care, but makes you pay for the actual care that results from prevention. It's like paying for a gym membership that includes free entry, but charges you per machine. Technically, you have access. Practically, you're paying constantly.
There's a psychological thing that happens when you're on a high deductible plan. It's called healthcare avoidance. And it works like this. You feel something off, a pain that's persistent, a symptom that's weird, something that probably should be checked. And you do this mental calculation. If I go to the doctor, that's $180 for the visit, maybe $300 for tests, maybe more for whatever comes after. Probably $500 all in. Can I afford $500 right now? Is this actually urgent, or can it wait? And you wait. Not because you're being reckless, because the insurance you're paying $450 a month for doesn't actually make healthcare affordable enough to use freely. So you self-ration, you delay, you hope things resolve on their own. And sometimes they do. Sometimes they don't. Sometimes the delay makes things worse, which makes them more expensive later. But in the moment, the math is, I have insurance, but I still can't afford to go to the doctor. That's not a personal failing. That's the system working exactly as designed. The high deductible makes you less likely to use care, which keeps costs down for the insurance company. They're literally betting that you'll avoid care to avoid costs. And here's the darker part of that bet. Even when you do need care, even when you go, you're still covering most of it until you hit catastrophic levels of spending. The insurance only becomes insurance when things are very, very bad. You're lying in bed on a random Tuesday. Your chest still hurts. It's been 3 weeks since that doctor visit. The prescription helped some, but not completely. You're wondering if you should go back. You're doing the math. Another $180 for a follow-up. Maybe more tests. Maybe a specialist referral, which is another copay. You haven't hit your deductible for the year. You're at maybe $900 spent so far. You've got $2,100 to go before any of this starts being covered at the coinsurance rate. And you're paying $450 a month for this privilege. That's $450 this month for insurance that isn't covering this. Meanwhile, your friend in a country with a different healthcare system went to the doctor last week. No copay, no deductible, no calculation. Just went.
So here's how people who actually understand their health insurance make decisions. And this isn't about gaming the system. It's about using the system with clarity instead of confusion. They track their out-of-pocket spending, not obsessively, just aware. They know where they are relative to their deductible at any point in the year, because that changes the math on when to do elective things. If you're at $2,700 of your $3,000 deductible in October, any remaining care that year hits the coinsurance rate instead of the full cost. So you do the dental work, the physical therapy, the things you've been putting off. They also front-load care in bad years. If you have a major health event in February and you know you're going to hit your out-of-pocket max, you schedule everything else that year. The dermatology appointment you've delayed, the specialist consult, get it done while you're in the window where insurance is actually functioning. And here's the reframe that matters most. They don't think of the premium as buying healthcare. They think of it as buying catastrophic protection. Insurance isn't there to cover your $180 doctor visits. It's there so that if you get seriously ill, you won't lose your house. That's what you're actually paying $5,400 a year for, not 12-minute appointments. Financial survival if things go very wrong. Now, let me be completely clear about something. This system is not broken by accident. It's expensive by design. High deductibles, narrow networks, complex pricing, all of it is structured to shift cost onto individuals and make care just difficult enough that people use less of it. And recognizing that doesn't fix it. Understanding the mechanism doesn't make your premiums lower or your deductible smaller, but it does change how you feel about it. You stop blaming yourself for not being able to afford to use your insurance. You stop feeling like you're doing something wrong. You're not. The system is just designed to feel like coverage while functioning like minimal coverage. So here's the thing about health insurance. It's not actually health insurance the way we think of insurance. It's catastrophic financial protection with a confusing layer of partial cost sharing on top. You're paying for access to negotiated rates and a ceiling on worst-case spending. Everything between zero and catastrophic, you're covering that yourself. The question isn't why does having insurance still feel expensive? The question is, what am I actually insured against? And the answer is financial ruin from major illness. That's it. Everything else, you're funding. Most people walk around feeling vaguely guilty for not using their insurance efficiently, or frustrated that it never seems to help. But the math is clear. For routine care, for moderate care, for most of what most people need most years, you're paying out of pocket until you reach levels of spending that most people never reach. It's coverage for the thing you hope never happens, and a very expensive waiting room for everything else.
That's the reality of health insurance. Thanks for watching.